Are you experiencing frequent headaches up to 3 times per week? We have a comment here from Alan on one of our other videos talking about headaches or migraines, and says that he'd love to hear more to understand more about what's going on because he is having headaches for all of his life, and the last year that's where he's been getting worse. It's been getting 3 times per week. I just want to say, Alan, I'm very sorry to hear about the headaches, the fact that they've been having for so long and now it is getting worse. What will be helpful after the video, if you can drop down some information for me, whether it's in the comments or sending a message, just give an idea more about what's been happening. So if it's something that, say, you've never been to see a doctor about, or maybe you've been to see a bunch of different doctors, what kind of people you've seen, what kind of tests you've had, what kind of things you've tried, what makes it better, what makes it worse, all of these things will be very helpful to get more of an idea of what's going on, as well as sharing your location. Because if we know where you are roughly, and we're not saying to your exact address, but if we know what city you're in, then if we're not able to help here in Singapore, at least I can do my best to advise who may be able to help you much closer, much more conveniently for you. So headaches have different types and forms. There's many different types of headaches that people may experience. Classic ones can be things like tension headaches, there can be migraines, there can also be more extreme versions, things like, say, cluster headaches. So there's lots of different differentiations, and some of them will have different causes. Some will actually have, to be honest, a very similar cause, but it may just be that it's not been picked up on, or it's not something that's been tested for as much, and it may be a bit strange to say that it's lots of different headaches with one similar cause, but it's just because people will interpret it differently in their bodies based on themselves, and also because symptoms may appear differently for different people, even though the cause of something may be similar. In the same way that someone may experience, say, tingling in their hands, someone may have pain, someone may have numbness, but all of it could come from the same kind of compression onto a nerve. Something similar can happen with headaches. So while headaches can be very common to happen, I just want to say they're never normal. One of the ways it can happen, of course, is because of things like stress. It can be more tension, it can be poor posture. Here in the practice, what we really focus on is looking for any other contributing factors, particularly something happening in the top part of the neck, because if there's something happening up here and something is more out of place, and that can start to put pressure on the nerves and the surrounding area, like the muscles, the joints, the ligaments, the tendons, and that may create a referral pattern going up to the head, which can cause headaches. So I'd advise for Alan and for anybody else, if you haven't already, go see an upper cervical chiropractor to make sure that there's nothing happening at this top level, or if there's anything which may seem more serious, like what we call a thunderclap headache, or something which is like the worst headache you've ever experienced, it suddenly happens. If something like that, please go straight to the hospital. Do not delay, do not go see a chiropractor or anyone else. Go straight to the hospital if you have that extreme headache which comes out of the blue for no reason, and maybe even you hear like a big snapping or loud sound. Go straight to the hospital. However, if you're someone who's had headaches at a chronic level,